Today we're going to talk about mid-back pain. Mid-back pain, upper back pain is something we see all the time, very common, lots of different causes for it. So we're going to talk about some of the basic causes we see, what you can do about it, what you can do to prevent it. A lot of people have this and we can manage it very well with different treatments, also just a lot of self-care. One of the things that people come in often and say, oh, I'm really worried about my posture causing this. And posture is a little bit of a challenge for this area. I don't think it's necessarily a bad posture or one position that causes upper back pain. It's usually people are just sitting for too long. So we need to try to get up and move every 15 or 20 minutes. The exercise we show today would be great to use as a movement break. So when you're sitting at your desk or you're doing one task for too long, try to get up and move every 15 minutes and do a little bit of movement with the upper back, maybe through the neck. One thing I know I see that kind of frustrates me at times, people come in and they'll say, oh, I have a rib out. I don't know what that means. Your rib don't really pop out of place. I think the pain can happen along the rib cage where it comes into the spine. You can get a little irritation sometimes with those joints. The muscles around it get tight, and very common source of pain. But the rib isn't out of place, and as chiropractors, we're not putting it back into place either. Sometimes we do pop those joints when we do some of the adjustments, and they can feel good. It can also feel good to roll your back out and get some pops that way. Doing some simple range of motion, you might feel some pops and it might feel good, so that's fine to do that. Any other thoughts you have?
Yeah, so we do see a patient with mid-back pain, mid-back stiffness, a typical treatment in the office. Well, first we want to know what their goals are, what they do for a living, what their daily habits are, and from there we can create a better picture of what's going on with their mid-back pain that they're experiencing. During an exam, we're going to assess the spine, we're going to look at the joints, we're going to look at the rib cage that comes around into the spine and kind of see how those motions are occurring with various functional tests that we do in the office. And with treatment, as Kevin already mentioned, that sometimes we will do some adjusting procedures to help get a stiff joint moving a little bit better, can help with some pain in the area, can also help with some local stiffness or tightness around the musculature. Also do some soft tissue therapies, help loosen up those muscles, and that can help take some pressure off of the mid-back and make the patient feel a little bit better. But ultimately, it's getting into the exercises and creating a habit on a day-to-day basis that can help create that motion, maintain that motion throughout the day, and that's going to help minimize pain and increase function during the day and with whatever their activities are that the patient wants to get back to doing.
I think another common thing we see is when people come in, they complain of their upper back, they're very worried about maybe it being shoulder pain or a mid-back problem, but it's sometimes often also a neck problem. The neck from in this area here tends to refer pain down towards the shoulder blade or the mid-back. So a lot of times if you're having pain with neck movement and you feel it in the upper back, it's actually more of a neck problem. So that's one thing with the exam. We want to differentiate where it's coming from. It's coming from the neck, it's coming from the shoulder, upper back, and then what can we do about it? Should we address the neck first, the shoulder? Probably all at once. Look at it, try and attack it from as many angles as possible to get it going as soon as possible. And as Charles said, trying to develop habits and routines so you can feel better more often without even having to come in.
So we're going to go through some exam procedures that we do, a little bit of treatment option, and then we're going to go over some of those exercises that can help you feel best during the day and get you back to your activities.
So we're going to take you through some different ways we look at upper back pain, differentiating where it comes from. Most likely it's going to be coming either from the upper back, the shoulders, or the neck. So we'll look at neck range of motion, so I'll have the patient look down to their chest, look up to the sky, back to the middle, side to side, both ways, look over to the right, look over to the left. Usually with one of those, they'll get some pain. Most typically when it's in the mid-back, it's going to be pain when they look up, or pain when they look to one or both of the sides. It creates some pain, and then it kind of radiates down to the shoulder blade or the mid-back area. If we're looking to see if it's coming from the shoulders, we just take them through some shoulder range of motion. So arms up overhead, down again, out to the side and overhead. And we're just looking to see if any of this creates pain. Sometimes we'll do resistive range of motion as well. So having him lift his arm and hold it, see if that creates any upper back pain. Maybe having him hold up, just pushing forward. So let's get some of the muscles that pull your arm back. They go and attach to the mid-back. So if any of those cause pain, we're looking maybe the shoulder and the upper back, how they work together something might be off there, and we can try to intervene. If we're looking at the mid-back itself, we'll go arms crossed, across your chest, across them, and then press into the area, see if that elicits any pain. Take them through range of motion through the trunk, see if that creates pain. Have them extend. Most commonly, we'll get pain with extension if it's coming from the mid-back. That's pretty common. So a lot of times people already complain about when they're coming in that when they arch back, they get some pain. Sometimes we'll see if compressing the ribs hurts, so we can squeeze from the side, see if that creates any pain, front to back, see if that creates any pain. So those are some of the basic things we'll look at, and then we'll also start looking at how they're moving. So the movements will help to determine where they're at and see what elicits the pain, is also to see what they can do. That'll help us give them exercises for take home. So let's take a look at that now. So we'll head over to the ground over here. So we'll start in an all fours position. So getting an all fours position, and then from here, I'm just gonna have the patient try to lift up through their upper back here into my fingers, and then try to sag all the way down here. So we're seeing how much they can move through that range and see if that elicits any pain. So he has pretty good motion, looking at the shoulder blades moving, and then at the top, really try to push up high. So if that's creating any pain, might shy away from it. If it's mild pain, and sometimes that actually might feel good for the patient, we might use that as an exercise to do at home, just getting through that range of motion. Next thing we'll do is kind of see how they can hold their shoulder blades on their back. That might tell us if that's contributing. So I can go hands and knees and up on his toes with their knees just slightly elevated. So in this position, we're just kind of seeing how the shoulder blades engage. Might have them crawl forward, so crawl forward, crawl back. So again, kind of seeing if they're able to do it, see if it creates pain, see if the shoulder blades look like they're stable. All right, go ahead and relax there. Next level, if that's all been looking good, we'll look at a push-up position. So getting in a push-up position and holding it. Again, looking to see how the shoulder blades are held. Try to push up a little bit more here, so that engages a muscle in the front called serratus anterior. See how they can control that. I would like to see some single arm, So we'll have him take the right hand to the left shoulder and stabilize, see if, again, if it creates pain, just see how well he can do it. He's doing all these pretty well. So these could be exercises depending on what we're trying to accomplish. From here, another position we can try is sitting on your heels, and then hands in front. And then we're gonna try to round, look down and arch through here, and then now look up to the sky. So this is a test to see if it creates pain, but also an exercise. It's called the Sphinx exercise. It's a really nice one to loosen up the upper back. Another good one you can use as a movement break when you've been sitting for long periods. Other than that, there's some other tests we might do depending on the situation, but that's kind of a basic overview of some of the things we look at with upper back pain. Now we're gonna go over some different exercises for the upper back, try to loosen it up and to strengthen it. So one of the first ones we're gonna start with, very basic, that a lot of people do, is thoracic foam rolling. So mid-back foam rolling. You can do it in a couple different positions. The way we first usually start with is the arms crossed in front, the foam roller about at the mid-back underneath the shoulder blades, and then just rolling back and forth a few inches. It's a pretty easy exercise. To get the most out of it, you wanna make sure you're just going back and forth a few inches. And then if you want to go higher or lower, then move the foam roller up or down and go back and forth a few inches. If you try to do it all at once, it gets a little clumsy and you might fall off of it. So just small little rolls. You might feel little pops, that's great. It might hurt a little bit, but it should be a good hurt and then hopefully better after. Another good position here for some people, if extending their back and neck feels good for them, we'll have them take their hands behind their head to support it, and then just using the foam roller as a fulcrum to bend and extend over. So that just kind of opens up the back, opens up the chest as well, and stretches some of those areas that a lot of people don't stretch when they're sitting at their computer station or doing their work for long periods of time. So again, it's another good one to do as a movement break. Another good way to use the foam roller is to put it parallel along your spine. So I'll take it, you want to get it on your tailbone and then on the back of your head so you're supported. And from here you can do a bunch of different exercises. One of the most basic ones is just a simple snow angel. So you're putting your arms down on the ground and you're trying to take them up overhead to open up your chest. And you might feel again some pops in your upper back. Usually feels pretty good. Another position is to take your arms side by side and then you're going to alternate them back and forth up overhead. Again, mobilizes the upper back, gets some of the muscles in the shoulder and upper back working. Great, so from here, now we're going to go over some different thoracic mobilizations. We're going to go back to an all fours position now. From here, very basic one, you just take the hand behind the head, and then you're going to rotate up to the right, and use your eyes and look up to the sky as well to maximize the rotation. You don't want to side bend too much, you want to stay in line, so if you come from behind, you'll see that position. Go back to the middle. So you usually do about 10 of these, and show them a side bend. So if you're kind of getting out of position, how you're seeing this bend, it's not as helpful as if you just keep everything kind of in a barrel and just roll and rotate from there. And then do 10 each side, it's a good starting point. And another one we like in this position is just a simple child's pose stretch. So you just sit back on the heels, reach your arms forward. From here, you can go in a bunch of different positions, whatever feels good to you. Reaching out to the side bending both sides. You can also rotate and take the arm under the other. Sometimes that's called thread the needle. Very nice stretch to open up your back. In these positions, it's good to take big, deep breaths in and all the way out. You'll feel some different stretching through the mid-back when you do that. Now we're going to show a different exercise, one of my favorites, called the T4 rotation. So we're going to stay in a child's pose-like position. You're going to take the forearms in front so your elbows are about at the ear level. And then from there, taking one hand behind your head to your neck. And first you're just going to start by lifting the elbow up as high as you can. You can do a couple reps just doing that. After you warm that a few times, now you're going to lift the elbow high, and then you're going to try to look up to the ceiling as far as you can. You'll really feel that along your neck and upper back. The muscles will be working hard, and get some good mobilization. Another good upper back mobilization is using a bench. You can use a bench or a sofa, bed, whatever you might have. You're going to be in a slight kneeling position. Take your elbows up to the bench. And then from here, you can move your hips away from the anchor point, and you'll feel the upper back kind of open up. You want to try to let this sag down, and you get a nice stretch there. You can also add some elbow extension as you're doing that. So you can straighten the arms against that. As you're moving away from it, really stretches out through the lats and through the upper back. Sometimes when people do that, the arms will want to come back together, so you can use something to hold on to. It could be a PVC pipe, a broom, anything you have around the house. And that will just help keep your arms a little bit more in line. And you can, again, just rotate, come back, or come back and then try to extend through it. That's a nice upper back opener and shoulder opener. Look at a couple other ones you can do against the wall here in a lunge position. The first one's doing an opening foot maneuver. So you're starting with one arm extended, the hips pushed up against the wall. You can try to push the knee against the wall as well and try to keep them plastered against the wall as your upper back's rotating. So now he's going to take his arm back to the side and open up through the chest, keeping those hips against the wall. And you can do this both sides. About 10 reps is a good repetition scheme. Another good one here is taking your hands behind your head, and you're using the wall as a barrier, and you're trying to rotate up and around without touching the wall. So you get the wall to incentivize you and be your teacher to work on your upper back rotation on this one. You can do this in a couple different positions. This one, he has the knee against the wall forward. You can do it with the other knee against, away from the wall forward, and then switch to the other side. So you get a whole bunch of different rotations with a slightly different position. Usually it feels pretty good. Again, these are all great to do as part of a movement break through your day. All right, now we're going to go over some different strengthening exercises for the mid-back. So depending on where you're at in your rehab process, these are common ones we'll prescribe. I'm going to start with some easier ones with the band. These are kind of level 1 type ones we'll do. And Jared's going to demonstrate how you do W's, T's, Y's, and I's. So the main thing here is trying to squeeze through the upper back and shoulder blades. And then your arms are making the position of the letters. These are W's. Those are T's. And then into a Y up overhead. And an I just down by your side. With all of them, trying to squeeze the shoulder blades. You can do it for reps. You can also squeeze and hold for a few seconds. Sometimes I'll have people do like a 5 count. But it's really challenging for the upper back. You'll see that a little shake in the muscles. Should be good and sore, good burn by the time you're done. All right, from there, we're going to move on to some intermediate exercises. And again, these are just a couple of examples of what we'll do. There's so many different exercises you can do, and we'll try to match where you're at with the exercise we're giving you. So this one's called plank roll. So we're going to put a furniture slider on the patient's back. We're going to have their legs spread a little bit, and then now we're going to have him reach back to the small of his back, take it out to a Y position, then rotate up to the sky, then back to the Y position, and then back onto his back. So we're getting some core challenge while we're making the upper back and shoulder blade work. And then do both sides. Depending on how they're doing with these, might be 5 reps. Looks like he's doing them well, but there's a little bit of challenge and shake going on, so maybe 5 would be a good number for him. Great, and then from here, we're going to go over a few kind of more advanced exercises with the kettlebells. So with the kettlebells, a couple of different ways we can use it to work the upper back. First way, when we're holding the weight in front of us, our body has to upright ourselves, so we're going to use our muscles of our upper back to be more upright. So having this load, just holding it could be an exercise. We could go into marches to make it more challenging. And then from here, to go into asymmetric load, instead of doing a goblet position, we can do a different front rack position with the kettlebell. And again, hold, we can go into marches. Next level from that, we might go to an overhead carry, so into an overhead press, and then again, marches, or we can do some carries. Another good one to work the upper back is to do suitcase or farmer's carries. Suitcase carry is when you hold it by your side. You want to get the shoulder blades set into the socket, stay nice and strong, and you just walk forward for about 10 steps, come back on same side for 10 steps, and then do it on both sides. If you're using a weight in both hands, then that's called farmer's carry. Both can be really good at working those muscles right in between your back. Next level from here that we can work on is, again, having the load in front and then doing some more challenging positions such as a squat. So we could do a goblet squat with the kettlebell. Again, that forces your upper body to work to keep yourself upright. So that's a good position. Another favorite that we have here is called a Zercher squat, which we can use usually with a barbell, or we like using the sandbags. So you have the sandbag, you hold it in the fold of the elbow, and then we're doing a squat from there. You can also do a lunge. You can do a lot of different positions from here. But again, having that load in front makes the upper back muscles work a little harder, which can help you recover from your mid-back pain. So again, these are just a lot of examples of some basic exercises progressions we do. We try to always match what the patient needs with the exercise we're given, so they're nice and specific in hitting your target areas of need.